Hello, I'm Alfonso Severos from Second Saturday. Right now, you are watching Health and Wellness with Rose and Green.
Can't keep doing the same things over and over again and expect a different result. And we have to have clear thinking, so we have to have the nerves flowing properly. So the spine is very important. So the spine needs to be corrected.
And I think generally, globally, that's where the world is heading. We have to remember who we are.
Welcome to another episode of Health and Wellness. I'm your host, Dr. Rose and Green, and joining us today is Dr. Robert Gucciardo. He is a master clinician in nutrition response testing and a licensed chiropractor for over 20 years, and he has also been on numerous mission trips. Welcome to the program, Dr. Gucciardo. As you know, COVID-19 has been with us for over 1 year, and it's a new normal for the entire world. For you as a doctor, speak to us as to how it has affected your practice and the patients in terms of them able to come in and get their care.
Okay, good question, Rose. Yeah, and New York was one of the hotbeds, and we're still kind of tight with all our restrictions. Not as much as others, other states have loosened their restrictions, but we were open throughout the whole pandemic. We were focusing on taking care of our patients because we knew the number one importance was to be there for patients because we're under a lot of stress. It can physically and mentally wear at us, and we needed to be, my patients need to be at their peak. I needed to be at my peak. So, patients got a little scared in the beginning. A lot of patients were holding off on coming back to care. They changed their schedules temporarily because they really didn't know what was going on and what to expect. And there was so much information being thrown at all of us that it was a little bit confusing. What do you believe? What do you not believe? What do you do for yourself? What do you not do? And that's what we were faced with. So, but it was really nice because we were able to empower people during that whole time and throughout that whole period of time. And now things are a lot lighter and people are moving about a lot more freely, wearing masks and doing what they need to do. Because we do need to get back into life because it does not just have a physical toll, but it has a mental toll, a financial toll on everyone. Everyone's suffering in one way or another. Yeah.
Also, Doc, thank you for that. But also, how early after the pandemic hit the US that you saw that persons were exhibiting fear as it relates to them coming out and they are not willing to leave their homes and come to the practice to get their patient care?
I think it was right away because people were just really nervous right away. They didn't know what to expect. They didn't know what to do. Nobody knew what to do. And but it was very short-lived. Like I said, it was about a month or so, and then people started, understanding. Okay, well, they're keeping the office clean and safe, and it changed our whole way we operate in the office right now. You've been here. You used to receive care when you were here in New York, and we had the waiting room, and people would hang out and talk and do stuff, and we're starting to see some of that come back, but people are still squirmish. So we have only a few people in the waiting room, and we'll have other people wait in other rooms, and we schedule it differently. It's added a lot more stress to the practice, but the patients are worth it, and we're here to make sure that they get what they need. So we fight through it. The staff fights through it.
What advice, also, Doc, would you give to your patients as to how to cope with the fear from day to day?
I think this pandemic has brought to life a lot of things for people. They're starting to realize what's more important in life, and a lot of people have cut out all the busyness of their life because it's not available to them, and I think it's made people look at life a little more simplistically. And I think it's taken a lot of mental stress off of people, physical stress and financial stress to compete and constantly be out there doing. So the one thing I think it has done is it's made people step back and take a pause and relook at their life. For the most part, some people are still very fearful and still not understanding and still trying to operate from the old basis that they did. and it's not helpful because it creates more stress. So how I talk to my patients is very simple. Number one, I think we need to practice gratitude. One of the things that I've been thinking about mostly is being grateful for the health that we have and the ability that our bodies have to fight the disease. Now, I know some people, some coworkers, some family members and patients have lost loved ones to COVID. And it's a terrible thing, and I feel for them. But we also need to understand that majority of the people, when we look at the percentages, 95% of the people recover. And one of the things that we need to think about is we've had epidemics in the past, we've had pandemics in the past. And the thing that I can encourage the patients most about is hang in there, it'll pass, because it always does. And it's going to change things because it's going to create a new norm in how we operate, but it will pass. And life will go on for the ones that remain. But the key is making sure that our bodies are strong enough to fight should we have to fight.
Wow, that's some very major important points you just made a while ago. That's very important, and that leads to my next question as it relates to nutrition. What advice do you give to your patients and just person in general as to how to cope with the virus if they do get it, and also how to strengthen their immune system to prevent themselves from contracting the virus?
I think that's where we need to look from that perspective. Our bodies are designed to fight. When we have a foreign body, an allergen, a bacteria, a virus, anytime something is in our body that's opportunistic, our body has to fight that. And we have to make sure that our body has everything that it needs so that it can fight. And if you think about it this way, think about a suit of armor. In the old days, the knights had armor and they went out and fought with swords and all this different stuff. And they had to make sure that the armor was solid. There couldn't be a little kink or chink in the armor, because that's an opportunity for someone to slice right into that and take care of it, to take advantage of that. So what we have to do is make sure and look at our bodies like a suit of armor. And we have to do everything we can to keep our immune system healthy and strong, to keep our body healthy and strong. So number one, that means that we need to first and foremost reduce sugar intake in our bodies so that we don't weaken the immune system. We have to reduce sugar intake because sugar will interfere with the absorption and metabolism of proteins that our cells need to stay strong. It'll interfere with the absorption of certain minerals that our immune system and cells need to stay strong and be able to fight. So we need to first, number one, reduce our sugar intake. Number two, we need to make sure that we get enough sleep, that we get enough rest. I know you know this, we've talked about it. The ideal time to sleep is between 10 o'clock and 3 a.m., so 10 p.m. to 3 a.m. And the reason why it's so important is because our adrenal glands reset at that time. And our adrenal glands reset the hormones that regulate, number one, our immune system, number two, our metabolism, number three, our blood pressure, and number four, our response to stress. And I think over the past year, people have been under a lot of stress. Best thing to do is get that rest. So number one, you want to decrease that sugar. Number two, you want to get that rest. Number three, you want to make sure that you're drinking plenty of clean water, breathing in a lot of fresh air. That means getting outside, walking, using what we have, using our resources to keep our bodies strong. Another way to do that is make sure that we have certain vitamins and nutrients to keep our immune system healthy and keep our cells protected. Vitamin C is great, but it has to be a whole food vitamin C, not a synthetic ascorbic acid. It has to be the whole vitamin C, at least 3,000 to 4,000 milligrams a day to keep the cells strong. Vitamin D3, very important. All of our cells and receptors in the body have receptors for vitamin D. So it's critical that we have it there because it will it's a hormone, and we need to keep our immune system strong. We need that hormonal regulation with the vitamin D. So vitamin C, the best way to get it without taking supplements is eating a lot of greens. A lot of good greens are rich in vitamin C. Kale, spinach, broccoli have way more C than most fruits do. So getting that in, is important. Vitamin D, getting out in the sun, not restricting your body too much and covering up too much, but getting a little sun to contact the skin so that you can create and metabolize the hormones necessary to synthesize vitamin D so we can use it and keep our immune system strong. Zinc. Zinc is a great way to get nutrients in to protect the immune system, 50 to 100 milligrams a day. If you're getting it from your diet, that's great. Then you don't need to supplement it, but you need to supplement if you're not getting that. Elderberry. Elderberry is a great herbal you see a lot of people talking about that. Elderberry helps to strengthen the immune system, regulate, body's response to viruses and bacteria and so on and so forth. So it's important to keep that in the body too, So these are things that we can keep. Another good one is echinacea. Echinacea works really well to support the immune system when it's under stress. But in echinacea, you don't want to take that long term, so you have to cycle it. Maybe take it for a couple of months and then stop for a month or so and then take it again. The other thing is if you have any allergies to certain flowers, echinacea might not work for you. So, these are all good things to do, but the key is getting good, clean water, eating a healthy, fresh diet with a lot of organic vegetables and fruits, getting enough protein so that your body can, create and regenerate new healthy cells and repair damaged cells. That's what we need to do that, and not just so that we can recover from COVID, but so that we can continue to move forward, because the after effects of COVID can be very strong from the reports that we're seeing. And from what I'm seeing with my patients who've had it, there are some lingering effects that have taken them a lot longer to heal and recover from, but nonetheless, they are recovering. Another thing, Rose, we can do is, we talked about practicing gratitude. Make a list every day. Research shows that people who practice more gratitude have a more positive outlook on life. They're able to fight disease better. They have less disease processes, less pain, less joint pain. They're more hopeful in their outlook on life. So we need to do that. Another thing, Rose, that you know as well as I do, your nerve system is critical in keeping your immune system strong. Our nerve system, our communication between the brain and the body through the spine, regulates and coordinates all bodily functions, including immune responses. So if we want to keep that armor strong, we have to make sure that that spine is in alignment and make sure that it's communicating what it needs to communicate to all tissue cells so we can fight, so that we have a fighting chance. And that's really my list of what I tell my patients. And it's something that has to be done. We don't have a choice at this point. We can't rely on outside influences to prevent what we do. We have to work from within and prevent, the outside from having an effect on us.
Wow, that's tremendous, because I'm sure a lot of our viewers really like that. Is extremely helpful, because a lot of persons they're coping with the after effects of recovering from COVID, and also the fear of contracting COVID. For persons we see where persons who have underlying problems, they are more susceptible to the virus. They're more to get it. For those persons, they're fearful. And rightfully so. They're truly fearful. But in terms of your own experience, the percentage of persons who contract virus, have the virus or recovering from the virus, are they those that actually have underlying problem issues?
There are, and for the majority, yes, you're seeing people with underlying conditions that are more susceptible or have a stronger response to the virus when they fight, or sometimes don't survive. Um, you know, it all comes down to the body's ability to fight. God put in us an innate intelligence that runs the body, that allows the body to adapt to all sorts of surroundings, cold and hot, and rain and snow and sun and bacteria and virus and drought. Like, our bodies are constantly adapting to it, and we have that amazing ability to. It comes down to the body's ability to adapt. So we need to strengthen our bodies as much as they can so they can adapt and fight. Listen, we're dealing with, you could have had COVID and not even known it. It could have came and went, and your body had the ability to fight it efficiently and move on. People who have a little bit more symptomatology had a little bit more of a struggle in fighting. People who had more severe symptoms had a little bit more struggle in fighting. And then people who did not make it, they couldn't adapt and didn't get through it. So I don't, we get hung up on this underlying condition thing. And gosh, I know two people who are patients of mine, one who's been fighting lung cancer for 2 years, who got COVID, tested positive to COVID, and had no symptoms. And you're talking about a lung condition. So you would think someone who gets COVID, who has lung cancer, is by no means going to survive or make it. So, we have to look at it that way. It's about the body's ability to adapt and change to the things that it's faced with. And that comes from lifestyle. That person with lung cancer is working hard at eating healthy and changing their lifestyle and getting through it. So, you know what? They're fighting better. They're also getting their nerve system checked and their spine checked. They're fighting better. They're taking the right nutrients. They're fighting better. And that's what it's about. How do we fight better, whether it's COVID, whether it's the flu, whether it's anything? How do we fight better? By putting the right things back in our body to allow it to function and heal and repair.
Thank you for that, Doc. Those points are very important. I'm sure my viewers are like, oh wow, we need to adapt those as well. And it leads to my next point as it relates to, we're facing a new normal. We're definitely facing a new normal. How do you prepare your patients to handle the new normal as it relates to making proper lifestyle changes as it relates to their diet, and how do they eat and how do they take care of their bodies?
Yeah. So regardless of, because what is the new norm? I don't know. How long are we going to wear masks for? How long do we have to do that for? And how long are we going to have that fear? I don't know. New York, we're still wearing masks. Florida and Texas, they're not. Some other states, they're not. And, the numbers aren't rising. So, it's what we do for ourselves. So if I can empower anybody, it would be, if you don't know what to do, consult with someone. Find out what your diet looks like and what it should look like. Find out how you can improve upon your life. Listen, we have, I joke, I call it Dr. Google, because anyone can go on Google and figure things out nowadays. We didn't have that years ago, but there is a lot of good, empowering information out there. Yes, you have to sort through some of the junk, but anything that's going to encourage you to be eating fresh foods, preparing your own foods, changing your lifestyle, getting more rest, anything along those lines that you want to listen to. There's so many resources we have out there to use. And I just encourage people, use those resources for good. Use them the right way and get the information you need. If the worst that happens, if you take supplements that maybe are, over and above what you should be doing, it's not going to have a negative effect on you at this point. It's just going to help your body. And whatever you don't need, your body's going to, excrete and get rid of. So, don't be afraid to take a supplement. If you're not sure, if you're on medicines and you're not sure, call your doctor, ask them what they think, and see if it's going to interfere with any medicines you're on. But I will tell you this. You change your diet, you start getting a little bit of physical activity, drinking plenty of water, and keeping your body strong, you'll get through it. You'll recover, you'll survive. And as far as the mandates that we have right now with masks and all these different things, and only having 50% of the people in a place, or 25% of people in a place, That's going to change. It's going to go back to normal eventually. Let's focus on what we can do now for ourselves and how we can empower the people around us to stay healthy, to encourage them, to help them lift up out of this, and we'll be fine. We'll be fine. Yeah.
We definitely need that, but coupled with nutrition, you're also a chiropractor, specific chiropractor. Alignment, having the proper alignment is very important to the body to send the signals through the nerves and stuff like that. Explain to us as to the importance, not just the nutrition side, but also having the proper alignment would help in preventing to contract the virus and even the common flu.
Our spinal health is critical. You know, our spine, it houses our communication center, our command center, our nerve system. And so the brain has to communicate with your heart. The brain has to communicate with your adrenal glands. The brain has to communicate with every tissue cell in our body for it to be able to maintain itself in existence. So if the spine, better yet, let me just show you that. So here's a spinal joint. Here's two bones. There's a disc and there's a nerve that pokes out on one side and a nerve on the other side. If these bones shift out of their normal position like that, it's going to pinch on that nerve and it's going to wear away at that joint and that disc. And that nerve, when it gets pinched, it's going to decrease the amount of information that actually goes out to the tissue and organ that it supplies. And that tissue and organ is going to start to decay over time. So now if someone has COVID or someone has this and it's going through the body and it's affecting different parts and it happens to affect that part, that's a weakened part. It's not going to respond very well to it, you see. So by keeping that spine in alignment and keeping it functioning the way it's supposed to, that allows for that 100% communication. And that's what it is. Now, don't get me wrong. It doesn't mean you're not going to get COVID. But like we said earlier, you may be asymptomatic, you may be slightly symptomatic, you may be a little bit more symptomatic. But if we keep this in line and keep the brain and nerve system communicating, and we eat well and we get the rest and we get enough water we need, guess what? We have a way better chance at fighting COVID and getting through it than doing nothing at all and just playing it by chance, you know? Yeah.
Thank you very much, Dr. Gucciardo. You are always on point with your advice that you give to the patients and also persons in general. I enjoyed the conversation today because you're always giving persons, whether we're outside of a pandemic, and know that we're within a pandemic, handling the pandemic. You have helped my viewers and also other patients to understand how to deal with the pandemic, the fear of it, and also the actual virus. So thank you so much for joining us this afternoon.
It's my pleasure. Yeah, thank you for having me here today. I miss you.
Also joining us on the other side of this break are the government officials from Jamaica as they speak about how they're handling the COVID-19 pandemic. Stay with us.
Today, March 15th, we received our first shipment of the COVAX facility, 14,400 doses of AstraZeneca vaccine. It represents the first commercial delivery under the COVAX facility and any other commercial facility within the Caribbean. So Jamaica is pleased to have been the first to receive this shipment. We will get another shipment early April, and from there on in until May, we should receive some 149,000 doses. We want to thank the PAHO WHO facility for working with us through COVAX to achieve the delivery of these vaccines. It will be put to good use. This plus the 50,000 we received from India will give us some 64,400. And we will certainly be working to ensure that our priority groups gets the opportunity to be vaccinated over the weeks to come. So thanks again. A good day today. More vaccines here in Jamaica. Thank you. A real significant occurrence, and coincidentally so, but nevertheless tells a story. 1 year we have been at it, and we are now embracing vaccines as an important part of the response to COVID.
to be able to say to the market that the Jamaican workers are all vaccinated is going to be a major marketing position for us. Because indeed, after this weekend, Jamaica might very well be the most vaccinated tourism worker group in the entire Caribbean. And that's a major statement to be made. The second key point of all of this too is that world tourism is moving towards harmonization of policies and standardization of practices. And one of the areas of common understanding and agreement is that to vaccinate means to enhance your security. And the world is also making positions in relation to categorizing countries on the basis of vaccination. The UK is talking about a red light, a green light, and an amber light to determine the levels of acceptance for destinations that their people can go to. The US is struggling with the issue of vaccination passports. The UNWTO and the World Travel and Tourism Council are all, along with IATA, struggling with finding a mechanism, what they call a biosanitary tool, that everybody can subscribe to enable travel to be seamless. So Jamaica will be well ahead of the game if our workers are all vaccinated.
I want to thank the team from Public Health who are here, led by our Regional Director, Errol Green, and of course, Primary Healthcare, Mr. Wallace, who leads the team on the ground in the communities. I think the team have been doing a very good job in Western Jamaica, as indeed in the country. Today at this lovely facility, the Convention Center, we have the space and the capacity to do well over 1,000 per day. I think we're on target for that 1,000 plus. I'm told we have done up nearly 700 already. We would like to do the same thing tomorrow and the day after, encouraging persons to come out and to take advantage of this opportunity to get vaccinated. And as Minister Bartlett said, the aim of the program clearly is to protect Jamaicans from all walks of life. And in this instance, we're doing the over 60s, but also, very importantly, in anticipation of economic recovery and the critical sectors that drive economic activity, create jobs, but also sectors that are most exposed by virtue of their type of service they provide. In this instance, the hotel industry, the tourism industry, dealing with foreigners or guests. I think it's important for us to give some priority to those sectors.
Thank you for staying with us. That's the end of our show for today. I want to always say to you, as we go through this COVID-19 pandemic, stay safe and stay well.